What is IgA vasculitis? Henoch-Schonlein Purpura. IgA vasculitis, also known as Henoch-Schonlein Purpura, is a condition that usually causes a rash. It is often called just IgA or HSP. The rash looks like tiny raised bruises. IgA HSP tends to affect children between the ages of 3 and 15, but it can affect adults too. The symptoms of IgA HSP usually go away on their own in about a month. What are the symptoms of IgA HSP? The symptoms can include a rash that looks like tiny raised bruises, joint pain, swelling around the joints, belly pain, and upset stomach. The rash caused by IgA HSP is usually the first symptom of the disorder, but not everyone gets a rash. Sometimes the first symptoms are joint pain and swelling around the joints. Some children also have symptoms affecting the stomach or intestines. For example, some children have nausea or vomiting. Others can have more serious problems, including something called intussusception. Intussusception is when the intestine folds into itself like a telescope. This can cause a blockage in the intestine and severe belly pain. IgA HSP can also cause problems with the kidneys, especially in adults, scrotum in boys, and other organs. IgA HSP usually causes symptoms only for a month or so. Then it goes away without causing any long-term problems. Some people, though, can have longer-lasting kidney problems. Is there a test for IgA HSP? There are tests that can help diagnose IgA HSP, but they are not always necessary. When IgA HSP causes a rash, doctors and nurses can usually tell what it is just by looking at the rash and doing a routine exam. If a doctor or nurse is unsure about whether IgA HSP is the problem, he or she can order a biopsy. For a biopsy, a doctor or nurse takes a small sample of tissue to look at under the microscope. The sample can come from a part of the skin that has the rash or, less often, from the kidneys. If you or your child has IgA HSP, the doctor or nurse will also want to do urine tests and blood pressure checks about once a week for a month or two. This is to check for signs of kidney problems. Should I see a doctor or nurse? Yes. If you or your child develops symptoms of IgA HSP, see a doctor or nurse. How is IgA HSP treated? Treatment mostly involves getting plenty of fluids, resting, and taking medicines to control pain, if they are needed. Most people can stay at home until they get better. People who have severe symptoms sometimes need to be treated at the hospital. To manage joint or belly pain, doctors recommend medicines called NSAIDs. NSAIDs are a large group of medicines that include naproxen and ibuprofen. People who do not get enough relief from these medicines sometimes get medicines called steroids, which help relieve inflammation. These steroids are not the same ones that athletes take to build up muscle.